Thank you, everyone, for joining us in today's webinar, Navigating the Hospice Final Rule Fiscal Year 2021. And today we are sponsored by Imark Billing. And before I introduce myself and Imark, just wanted to talk a little bit about some house rules. So first off, you will be able to ask questions throughout the webinar. If you look towards the bottom of your screen, you should be able to see a Q&A option. There's also a chat option on your screen. So you'll be able to put in questions there, and those will come directly to me. We will try to get to the questions live if possible. Otherwise, I will be answering all of the questions, and I will put together a document with a Q&A, and I will send that off to everyone, including with a recording of the webinar as well. So you will get that in, I'd say no later than a week after the webinar. So no matter what, if we don't have time for the live questions, you will get those answers to your questions later on after the recording. Now, another thing also on the chat, I did put the link to the handout. So what you need to do is just copy that link and open a new browser on your computer, and you should be able to get access to that the handouts. Now, if you're having any issues with that link, hopefully you don't, but in case you do, we did also send out an email reminder of this webinar, and in that email reminder is the same link, so you can access the handouts. But again, if you do have any problems, don't worry, because I will send out all the handouts as well, along with the recording and the questions and answers as well. All right, so a little bit about me. My name is Lynn Labarta, and I am the founder and CEO of Imark Billing. We've been around for 17 years, and we focus on billing and coding for the home health and hospice industry. We have clients all over the country, and our job is to handle the entire billing and coding process for agencies just like yours. That way you all can focus on quality patient care and, of course, being compliant with all the new regulations that are constantly popping up. So let's talk, let's get into the webinar. There's a lot that we need to speak about. So, you know, the Hospice Final Rule was hundreds and hundreds of pages. And my goal for today is to break it down for you all in the simplest of terms possible, and really just go over the parts of that final rule that you really need to know. The most important parts where you, as an agency, are actually going to have to take action and certain steps in order to stay compliant and be compliant. So what I've tried to do is summarize. You'll see some action slides at the end of some of the slides. They'll say action steps, and I've tried to make it as easy as possible for everyone to go directly to those slides and see what actions you need to take. So let's talk a little bit about what we're going to discuss today in the final rule. So first, we're going to discuss the changes to the hospice wage index. We'll talk about the SIA payments, that there were some potential changes to that, but we'll go over that. We're going to discuss the increase in payments for 2021, and of course, the updates to the aggregated cap amounts. We're going to talk in detail, and this part is very important. There were some changes, documentation changes on the hospice election statement and the new form that was added, a hospice election statement addendum. So we're going to get into the details of those. We're going to show you some samples as well that CMS has put out for the modified election statement, as well as that addendum. You'll be able to see those models, those samples at the end of the handout. It's towards the end of the pages, so you'll actually see the samples. And we're going to go over those in detail, of course. We're also going to clarify, because we've had a lot of questions on this, we're going to clarify when to use an ABN form versus an election statement addendum. There's been a ton of questions on that, so we do want to go over those and clarify when you need to use each. Okay, so the first part is going to be, we're going to talk about the financial part of the final rule. So this final rule is going to be implemented on October 1, 2020. So overall, the financial impact to hospices have really been a good one. We've had a small increase in our payments, around $540 million for 2021. But, you know, when it comes to our individual agency, that really translates to about a 2.4% increase in our payments. May not be a lot, but it's something. It's positive. So next, we're going to talk about the wage index and what that really is. Now, it's not necessary to get very deep into this concept, but it is a good idea to have an overall understanding on how your hospice payments are calculated. So the wage index is the system used to adjust reimbursements to home health agencies all around the country. And what it does is it uses the different local wages in the specific geographic area that your hospice is in. So this is, you know, it takes those wage differences all around the country, and it's used towards calculating our payments for the hospice. So, you know, it's also based, like we said, on where you are geographically in the country and where the patient lives, or where you're servicing the patient. Could be in a facility as well. So all of that geographical data, along with the local wages, are used to calculate our payment. So the payments to hospices are based on what's called a CBSA code. Now, a CBSA code stands for Core-Based Statistical Area, CBSA. And these, basically what they are U.S. geographical areas that were defined by an office in the government called the Office of Management and Budget. So they call that the OMB. And it really consists of one or more counties that comprises the wage index. So again, it's counties, specific counties where the patient is being treated, and a CBSA code is created for those specific counties. So what's happened in this final rule in 2021 is that some counties have been, or some CBSA codes have been adjusted. So that means that some counties have been classified as, that maybe were classified as rural, have now changed to urban, or maybe the other way around, where certain counties were classified as urban and now they're being classified as rural. So, you know, in addition to those changes, there were also some changes to specific CBSA codes. Now, you know, why is this important? You may be asking that. And and this is actually very important. And the reason why we need to touch on this is because depending if you're an agency that was affected by a change in your CBSA code, you could potentially see an increase or even a decrease in your payments. So that is why this is very important. And there are going to be some action steps that you're going to need to make to ensure that you're going to be getting paid properly. And we're going to get into the details of what those action steps are in the next few slides. All right, so just to be a little bit more specific, there was about 34 counties that moved from urban to rural, about 47 counties that moved from rural to urban, and this is, of course, in multiple states. So like we discussed before, some counties changed to a totally new CBSA code. Some were slightly modified. You know, like we said before, if you're an affected agency, it is going to be important to take some action steps. And all of this would be effective on October 1, 2020's billing. So what you're going to want to do is, if you were an affected agency, and even if you're not, because you would need to look at the CBSA code list to see if your particular CBSA codes have changed. But the easiest thing to do, and the action steps that you're going to want to take, is to contact your software before, at two different times. First, it's going to be before October 1, 2020, and you're just going to want to make sure that your software has updated their system with the new CBSA codes. Now, this is nothing rare. Your softwares are going to know what you're talking about because the CBSA code changes happen regularly in home health and hospice. So, the key though is for you to contact the software first before October 1, 2020 to make sure they updated it. Then you're going to want to contact them again before January 1, 2021 to confirm that they've updated it with the new list, because there's going to be two different lists of updated CBSA codes coming out at two different times. So you're going to want to make sure that the software has updated them. And that is really the key action step here, because we have seen agencies that have gotten paid incorrectly in the past in either home health or hospice because their CBSA codes have not been updated for some reason by the software. Another step you may want to consider is speaking with your billing department or your CFO or your financial team that does your budgets and your financial reporting, just to let them know that there may be an increase or decrease due to some CBSA code changes. That way your budgeting stays on track. All right, so again, if you are an affected agency, the good news is that CMS put in a cap to the wage index decrease. So that way, if you are an agency that has seen a decrease in payment, you are not going to lose more than 5% of that wage index. So CMS put this in place as really to decrease the financial impact to agencies. So that way you don't have a major decrease in revenue. So that's the good news about this. So let's talk a little bit about our changes to the different levels of care. So the first two and the most routine, most common levels of care are going to be our routine home care. Days 1 through 60 are considered our high routine home care, or our low routine home care, which is day 61 plus. As you can see in 2020, the different rates are $194.50 and $153.72. You see a slight increase in that. All the way to the right in the chart, you can see for 2021, we had a small increase, $199.25 and $157.49. It's not much, but it's definitely something. Every penny counts when it comes to our reimbursement. Now, as well, the additional levels of care, which are your continuous home care and our inpatient respite care and general inpatient care, those three did also see an increase, again, a small increase in revenue for 2021, $1,432 with 41 cents, $461.09, $1,045.66 respectively. I think, what's really important here is that these three levels of care had a significant increase. So this year's increase is small, but last year the increase was significant specifically to these three levels of care. And that was really a great thing, because finally Medicare realized that they needed to increase these levels of care so we can actually make money or even cover our costs, really, for treating these patients at this level of care. But of course, with that said, because there was a huge increase last year, I do want to say that Medicare is watching us. They're watching us through data analytics, really. And they are doing this because they want to ensure that there aren't any significant changes in the behavior that, of our agency that could indicate some wrongdoing. And these things happen, whenever there's a huge increase in revenue or big changes that do affect our reimbursement. Medicare puts is very careful at watching our behavior and watching our agency, just to see what type of changes may happen in the agency. So really what I mean is, let's say, for example, that you're an agency that had zero money coming in for continuous home care, as an example, right? And then suddenly last year, there was a significant increase in your continuous home care, or maybe your GIP payment. So if that happens, there's going to be a red flag that's going to be raised over at Medicare, and they may very well ask you for a medical review or an ADR to see if those payments were legitimate. So really what you want to focus on is ensure that your documentation, it's all about documentation. It needs to reflect the need for that higher level of care. And there needs to be supporting documentation as well in your records to be able to support that. And that way you're going to be able to cover yourselves and ensure that if there are any ADRs, the services, the higher levels of service that you're providing are medically necessary and they're documented properly in your chart. So that's the one thing I want to say about the changes in revenues for these specific levels of care. All right, so a little bit about the SIA payments. We were all really excited in 2016 when the SIA payment was added, but we were a little scared that the SIA payment was going to go away for the final rule for 2021 because there was some discussion that they would possibly remove this extra payment. And really, it's because CMS didn't see that agencies were furnishing the levels of care that are required during the last 7 days of life for the patient to get that additional money. So what they've said is that they're going to be monitoring us, and they're going to be monitoring if we're performing the different services, RN and medical social worker services during the last 7 days of life, and if they feel that we're not taking advantage of this additional payment, then they may remove it. So we're going to have to monitor this year to year. So for any of you that might not be sure of what the SIA payment is, it's an additional payment that applies only to the last 7 days of life when a patient is discharged as deceased. And of course, it's only applies when you're using the routine home care level of care. And it's for medical social worker and RN services. So we're going to have to monitor this closely and hope that Medicare does not remove this additional payment. I think they also want to remove it personally because it's been a bit of a nightmare in calculating the SIA payments. I know when this first came about in 2016, they were making many errors in calculating the SIA payments. I still feel that they're still doing the same thing. I don't think the algorithms in Medicare systems are working properly. So I feel that's another reason why they may want to remove this. So we'll just have to watch and see. All right, let's talk about our hospice cap. The hospice cap does increase every year for cost of living. So the increase we're getting in 2021 is going to be for $30,683.93. Our current cap amount is $29,964.78. So, again, that's a good thing. It is an increase. We are, we're always monitoring this. It's always going to be increased slightly every year. But, what's important, just to talk a little bit about the hospice cap, what's important about the hospice cap to know that it's an aggregate of all of the patients that you service for a particular fiscal year. So what you're going to do is you take your total amount paid of claims, and you're going to divide that by the total number of patients that you've seen during that fiscal year. And that should equal your cap amount or less. Now, if you do that calculation and it does not equal the cap amount or less, then you could be in a situation where there's going to be an overpayment. So any monies over that cap amount are going to be considered an overpayment, and you'll need to pay Medicare back for that. Now, keep in mind that you are going to see some patients, some individual patients, where you are going to get paid more than that cap amount. And that's fine, okay? And you will see some that you'll get paid less than that cap amount. There's nothing wrong with that. It's normal. What you need to remember is this calculation is done on aggregate, or basically as an average of all of the patients for that cap year. So I know sometimes agencies panic when they see a particular patient that has gone over a cap, and it's fine as long as you have 2 or 3 other patients that are going to offset that were short lengths of stay. So another thing that I did want to mention about the cap, which is a lot of questions that we get as well, is knowing the history of the patient is really important because your cap amount does apply and carry over if the patient was transferred to your agency. So, if the patient was in hospice prior to being admitted to your hospice, the cap amount applies, and keep an eye on that. All right. All right. So that is really all you need to know about the financial section of the final rule. I think the hot topic and what we really need to make sure we get right is the documentation part of the final rule. And that's what we're going to talk about next. And here you are going to have to take some action steps. And you'll have some slides that say action steps, so you'll know exactly what you need to do when you go back to your agency. So effective for admissions on or after October 1, 2020. So what we're talking about now is going to be effective only for admissions on or after October 1, 2020. So any admission before this date, these new rules do not apply. So I wanted to clarify that because we've gotten that question a lot. So what has changed? What has changed is there is now a modified hospice election statement. And, we're all currently using an election statement, but now there's basically some new language that Medicare is requiring us to add to that election statement. And we'll go over that language exactly moving forward. So in addition to the modified election statement, there's also a new hospice election statement addendum. This is a totally separate form that needs to be called, and it has to be called, Patient Notification of Hospice Non-Covered Items, Services, and Drugs, if requested. Now, we're going to get into the details of that, but that is a separate form that is going to be required to be provided to the patient or representative if it is requested. So this new form is going to be a condition of participation, or a condition of payment rather, if it's requested. And we'll go over what if it's requested means. The good thing is that CMS has furnished us with templates, specific templates with the exact language that needs to be on either, the modified election statement and the actual new addendum. So we've got those templates. They're at the end of your handouts, and we're going to go over all of those now. All right. So I do want to mention that another question we've gotten a lot is, due to COVID, have there been any delays? So the answer to that is no. There are no delays in the implementation of this final rule. As of October 1, 2020 is when you need to start using the modified election statement and the new addendum. So no changes to that, no delays. So let's talk about why CMS has modified the election statement or wants us to add new language to that, to the current election statements that we use. And let's also talk about why they want us to use this addendum. So really what they feel is that there needs to be more coverage transparency for patients, really so they can better understand what is and is not covered under the hospice benefit. We all know that this is tricky, and sometimes patients are not clear as to what is or is not covered under the hospice benefit. So Medicare felt that there needed to be some additional language and a new form, so it is a little bit more clear for patients to understand what's covered and what's not covered. And they also, in addition, want more accountability for hospices. So they really want to make sure that hospices are explaining this properly to patients. And the only way they can do that is by adding more regulations, to us as hospices. So again, CMS felt that patients did not really understand what is covered or not covered under the hospice benefit. So really, the purpose of all of this is for clarity. All right. So the modification to your current election statement is required for all hospices. So like I said before, as a hospice, we already use a hospice election statement, but now there just needs to be some modifications done to it. As you know, there's a requirement by CMS, so we all need to do this. I say best thing is to use the sample that Medicare has provided to us, but again, that's my personal opinion. We're going to go over that sample so you can see, and then you all can decide for yourself. So in addition to the modification of the election statements, we've also had in addition a new document called the Hospice Election Statement Addendum. And it's only required, though, if requested by the patient or the patient's representative or Medicare, the MAC, which could be Palmetto, NDS, or CGS, or if requested by a facility, which might be, when we talk about facility, that might be maybe a facility that is treating the patient for unrelated reasons. And this addendum must be provided to the patient within a certain time frame. So we're going to talk about what that time frame is. All right, now the addendum, it's a document that what it does is it just states the services the hospice will not cover, such as certain drugs or services or maybe other items, because the hospice has considered those items to be unrelated to the terminal illness. So if that's the case, then an addendum may need to be created if the patient or family or Medicare or facility requests it. And we'll talk about that in detail moving forward. Okay, so first, let's talk about the changes to the hospice election. There are 4 new requirements that need to be on that hospice election statement. And please note, this is also a confusion. This is effective October 1, 2020, so that's around the corner. So these new requirements have to be added. The new language has to be added to your election statement very soon, so you're in compliance. Now, you can use your own hospice election, that you currently use, and you can just add the new language. That is totally fine. Maybe even your softwares have done some kind of template where they've already added the new language. So you may want to find that out with the softwares. You can also use the sample that was provided by CMS and that we've provided in the handouts at the end of the handout. So we're gonna go over that handout in detail now. All right, so let's talk about the changes that have to be added, the modifications that have to be done to your hospice election. So the first change is a statement that needs to be added that says information about the hospice comprehensive nature of the Medicare hospice benefits. So that is language that needs to be added. And if you look at your handout that CMS has issued, there is an explanation there on the holistic nature of the hospice benefit. And this needs to be explained to the patient, so they can understand. And if you look in that template that we provided for you, you'll see that language and that explanation under the section called Hospice Philosophy and Coverage of Hospice Care. So it's just a matter of reading that to the patient and explaining to them what hospice is about. So the second is a statement that, although would be rare, there could be some necessary items, drugs, or services that will not be covered by the hospice because the hospice has determined that these items, drugs, or services are to treat a condition that is unrelated to the terminal illness and condition. So this language, just like that, needs to be added to your new election statement, to your modified election statement. Information about beneficiary cost sharing for hospice services. I'm going to talk a little bit more about this section, and that might be a small change that you may want to do to the model, but I'll give you some examples of what you need to put in there. Otherwise, the CMS's model simply states that, just has that statement on there. And that statement should suffice and meet the regulations as well. Okay, and the fourth change and the fourth modification that has to be done to your hospice election statement is the notification of the beneficiary or representative's right to request an election statement addendum. That includes a written list and a rationale for the conditions, items, drugs, or services that the hospice has determined to be unrelated to the terminal illness and related conditions, and that immediate advocacy is available through the Beneficiary and Family-Centered Care Quality Improvement Organization, which is also known as the QIO, if the patient or representative disagrees with the hospice determination. So what is all this? This is a new item that needs to be added to your election statement. But, you know, as we mentioned before, this exact statement is on the model. So this is literally what you need to add to your current modification statement if you're going to use your own. And we'll talk a little bit more about this also in the next slide. All right, now, before we get into that part, let's actually talk about the cost sharing. That was the section 3, the third modification. So what the cost sharing is really about is, you know, it's really related to explaining to the patient what, if any, financial responsibilities they may have specifically related to the co-insurance for drugs and inpatient respite care that, you know, that the patient might be responsible for. So, you know, CMS has not stated that there needs to be any specific language on that modification of the election statement. That's why they just put in this vague sentence that states information about beneficiary cost sharing for hospice services. They basically just put this boilerplate statement. But what this really means is about the fact that the patient may be financially responsible for some of the co-insurance for drugs or inpatient respite care. So I think the easiest thing for you all to do is determine if you're an agency that does charge for the co-payment for drugs and inpatient respite care, then just simply state that in your modification election statement. State that, you know, and here's an example in quotes, that while under a hospice election, there may be cost sharing for hospice medications and inpatient respite care. That's it. That's all you would have to put if you are an agency that does charge the patient for co-insurance for the drugs or inpatient respite care. Now, if you're not an agency if you do not charge the patient for any co-insurances for drugs or inpatient respite care, then you can just simply state that. And that's enough about, that's all you need to state about the cost sharing. Now, you know, here, an example here is that you can also put a disclaimer in the election statement that says, I understand that services not related to my terminal illness or related conditions will continue to be eligible for coverage by Medicare. You can also put that blanket statement. So I would say that that is probably the only change that I would add to the to CMS's model. Just, you know, state whether you do charge copays or you don't, or co-insurances or you don't. Another section that you do want to do a small addition to would be this section here that talks about the QIO on the model. So this is the advocacy organization that we just talked about that a patient can call if they have any complaints or maybe because they don't understand something in the documentation. So the information here will also need to be on the addendum, that new additional election statement addendum form, and we'll talk about that addendum next. But here in the modified election statement, you may want to add your local QIO, the name of your local QIO, and the phone number. That way it's a little bit more transparent and easier for the patient to reach out to if they need to. And you can find this by just Googling it. If you go into the internet and Google, you should be able to find who your local QIO is, and then just add that. All right. So let's talk about, so this is the summary, okay, that I mentioned at the end of each section, that on the action steps that you have to take for the modification of your current election, okay? So one, you're gonna want to review your current election statement, okay? You're gonna wanna ensure that all of these new requirements that we just talked about, the 4 new requirements are there, and that any current requirements are also being met on your form. It's a good time to just review it. Make sure you do not leave any sections blank on your election statement, because that is a problem. That way you can avoid unnecessary denials. We have seen many denials from ADRs due to the technical requirements not being met on the election statements, especially the part, the section on choosing the attending physician. That's a source of many technical denials. So, you know, I personally think that using the template provided by CMS and just adding those small requirements, those small additions that we just talked about, is going to meet the requirement. And I think it's just going to be easier because, you know, think about this. If there's an ADR that's requested, the reviewer who's reviewing your chart already knows this form. So you're going to be making it much easier for them to just quickly review it and move on through the chart. Because if you instead use your own, then again, there's no problem with using your own at all. You can. I just feel that sometimes using your own form makes it a little harder for these reviewers to find the necessary requirements, and you could possibly get a denial on your claim because maybe they just missed it because they're unclear with that form. So I'm just of the feeling that making it as easy as possible for the reviewers that are looking at your ADRs is really important. You just want to spell it all out for them because we all know that they make mistakes all the time. So again, consider using that template, might be a good idea. Adding the disclaimer on the cost sharing and adding the specific QIO is all you really need to do on the template. All right, so now let's talk about the new addendum. So as we said before, this is a separate document that must be titled Patient Notification of Hospice Non-Covered Items, Services, and Drugs. Again, we said that the purpose of this document is really to inform the patient upon request of what drugs, services, or items the hospice will not be providing, since the hospice has determined them to be non-related to the terminal illness. You can create your own form if you want. We have included the CMS template here, which I recommend using. Now, this form is only required if requested by the patient or the patient's representative or CMS or a facility. Now, what we've been hearing is that some hospices are considering providing this addendum to all of their patients automatically. Now, that is completely up to you and completely up to your agency and how you want to handle this. That is not required. It's doing the form, the addendum, and turning that over to whoever asks for it is required only if they request it. And we'll get into that in a second. But if you want to just create the addendum and give it to all the patients as a policy for your hospice, you can do that. Some hospices feel that that's going to be easier so they don't run into any issues where they may not be compliant because they didn't hand in the form or they didn't hand it in within the appropriate timeframes, because that would end up being a condition of payment. And if they ever ask you for the chart, then it could be a denial. So some agencies are just deciding to do that automatically on their own. You must include in that addendum a list and a rationale for the conditions, items, and services and drugs that the hospice has determined to be unrelated to the terminal illness. We're going to go over that form and that template now. Here's a sample of what it looks like, but you've got it at the end of your slides. So we'll talk about exactly, what the details are of that form. Now, if the patient, now something I do want to mention, that if the patient doesn't request the addendum, there does need to be a section somewhere in your documentation that records that you did speak to the patient about the addendum. It's got to be on there. Otherwise, there could be a denial if there's an ADR requested. So in the sample that Medicare provided to us for the modified election, there is a section there that says that you did speak to the patient about it, that they requested the addendum or didn't request it. So that covers this requirement. But if you're going to use your own form, make sure that you add somewhere there something about the fact that you have spoken to the patient about the addendum, because they may not request it, which is fine, but there's got to be some documentation that you did mention it to them. All right. So let's talk a little bit about the deadline. This has been very tricky. We've gotten a ton of questions on this because it is a little confusing what the requirements are for delivering that addendum to whoever's asked for it. So the addendum needs to be provided to the patient or patient's representative within 5 days if requested at admission. Otherwise, it needs to be provided to the patient representative within 72 hours if requested at any time during the course of the hospice care. Now, I created a little chart in the next slide that makes this a little bit easier for you to have it spelled out, and maybe a little sticky that you can put on your computers or give to your clinicians. And we'll talk about that in the next slide. Now, if requested, the addendum must be signed, dated, and included in your medical record as a new condition of payment. So that's if it's requested. If the patient dies within 5 days of the hospice election, the addendum is then, the written addendum is not required. Now, also keep in mind that if the addendum is requested, then there needs to be updated addendums to the beneficiary if it's required, of course. If there's been like a change in the plan of care, where there's a new illness, new condition, then that, you must reflect whether or not items, services, supplies related to the new illness or condition will be provided by the hospice. So that updated addendum does need to be signed and dated and included in your medical records. So here's a little chart that I think is helpful because, again, there's been a lot of confusion about these dates. So let me give you an example. So if the patient elects hospice, let's say on May 1st, and they signed all of the consents on May 1st for an effective date of May 7th. Okay, so the effective date is going to be May 7th. If the addendum is then requested, then the deadline is within 5 days of the effective date. And in this example, the effective date is May 7th. So the addendum has to be delivered within 5 days of the effective date if requested at the time of admission. Now, if the addendum is requested, let's say on May 8th or any day after that, then it must be provided within 72 hours. So you can see how tricky this is. And this is one of the reasons why we're hearing a lot of hospices are just going to do the addendum, on admission and just hand it over to every patient. All right. Okay, so like we said before, it's a condition of Medicare payment, and it must be reviewed and offered at the time of hospice election. So like we said before, you must document somewhere that this was discussed with the patient and representatives. Now, in order to provide the addendum, it must be requested, and it must be provided in writing within the requested time frame that we just went over. It must be signed, dated, and incorporated into your medical record. It must be updated as well if there are any new conditions throughout the election, the hospice election. So CMS suggests that the process of updating the addendum could be something similar. It could resemble the process that you currently use for updating your plan of care. So whatever that process is, you could now incorporate the process of updating the addendum as well within that current process that you have. All right. So let's go over some specifics on the addendum form. And we're taking this right off of the template that's at the end of the handout. So section number 1 is the name of the hospice. So that's pretty straightforward. Section 2 is the beneficiary's name and the hospice's medical record identifier number. Section 3 is identification of the patient's terminal illness and related conditions. Section 4 is where it's the list of the beneficiary's current conditions and diagnoses present on the hospice admission or upon any kind of update to the plan of care, and the associated items, services, and drugs not covered by the hospice because they have been determined by the hospice to be unrelated to the terminal illness. So again, we're taking this right from the template that Medicare provided to us. So section 5 of the template for the addendum is a written clinical explanation in language the beneficiary and his or her representatives can understand as to why the identified conditions, items, services, and drugs are considered unrelated to the terminal illness and related conditions and not needed for pain or symptom management. So this is really a general statement. A general statement is fine. It would suffice as to why the decision was made as to whether or not certain conditions, items, services, drugs are not going to be covered. So it's just going to be a general statement. This general statement, number 5, is what's actually written in the sample, and that would suffice. That would meet the requirements. So, sometimes you just don't want to reinvent the wheel, and you want to just leave this exact language. But you do want to tell the patient that they can share that clinical explanation with any other kind of healthcare providers, for example, which they're seeking services that are unrelated to the terminal illness. You can tell the patient that they can use that addendum and give that to any of those facilities or that may be requesting it. Number 6 is references to any relevant clinical practice, policy, or coverage guidelines. Also CMS has not specified, something I did want to mention because we have had some questions on this. They haven't specified who specifically needs to provide this explanation to the patient or family, but we're assuming it's going to be the medical director or the admitting nurse that would just explain this addendum to the patient. So section number 7 simply states information on the following domains, which are the purpose of the addendum and the right to immediate advocacy through the QIO. So these 2 sections are also on the template that Medicare provided us with the exact language that would meet the requirement and that needs to be told to the patient. So you're basically reading this statement, this addendum to the patient. All right. Section 8 has to do with the name, signature of the patient or the patient's representative and the date signed, along with a statement that the signing of this addendum or its updates is only an acknowledgement of receipt of the addendum or its updates and not necessarily the patient's agreement with the hospice's determination. So this is very important to explain to the patient. So this language is already on the addendum, but you need to explain to the patient that by signing this document does not mean that they're agreeing with the hospice's determination of what is not covered. That signing this addendum simply is an acknowledgement of the receipt of the addendum. So that's an important clarification to make to the patient or caregivers. All right. So let's talk, this is also a question that we've gotten. If it's requested, the addendum is requested from any other facility type or Medicare directly, anyone other than the beneficiary or the representatives. This is an important point. If a non-hospice provider or Medicare contractor requests the addendum, but the beneficiary or representative did not already request and sign the addendum, this would not be a violation of condition of payment. So what this means is you would have to create and provide the addendum to whoever is asking for it within the required time frame as well. Keep in mind that you have to do it within the required time frame, but the patient does not have to sign it. Okay, so that's an important point, because since the patient or family never requested it, you never gave it to them, they never signed it, it's not a part of your medical records. So we've had agencies, panic at thinking that this would be a problem, but it wouldn't be. Okay. All right, so let's talk about the action steps that need to be done at this point. So beginning on, you can either use, create your updated modification statement, or you can use the CMS templates of the modification and the addendum. And this needs to be effective and done by October 1, 2020. Okay, so whichever option you go with, it needs to be ready by October 1, 2020 and in place. You want to update your policies and procedures to reflect the new changes to the election statements and the use of the new addendum. You're going to want to train your hospice staff on the new requirements. And mostly it's really, the fact that you want to talk to them, your hospice staff, on how to explain the election statement and the addendum to patients and their families. And you're going to want to create an auditing process for all your new admissions on or after October 1, 2020, to ensure the new requirements are being met, including reviewing the dates required that they're being met as well. That's going to be the key here, making sure that you're compliant with the deadlines for handing those documents over. Okay, so, okay, give me 1 second. It looks like my screen is frozen. All right, we're almost there. Let's see. Looks like my screen is frozen, so let's hold on. Okay. All right, there we go. Took a second to react. All right, let's go over some common questions that CMS has published on the addendum. So first, does the hospice have to provide the addendum when the beneficiary or beneficiary's representative requests the addendum, but the hospice has determined that there are no unrelated items, services, or drugs? So the answer to this is the hospice could just simply explain to the beneficiary or representative that all of the services are covered, or the hospice can provide the addendum noting that the hospice has determined that there are no unrelated conditions, items, drugs, services, so all of that is covered. So you can either provide the addendum stating that everything is covered, or just simply explain it to the patient. So remember, the purpose of the addendum is to explain to the patient what is not covered. So if everything is covered, then you either don't have the addendum and explain that to the patient, or just have one stating that everything is covered. All right. Another question was, can the election statement addendum be provided electronically? The answer to that is yes. But of course, if a hard copy is requested, you do need to provide that. Next is, how should a hospice handle a situation where the patient beneficiary refuses to sign the election statement addendum? So Medicare feels that this is just simply not going to be an issue. They said that, you can explain to the patient that they've requested, they're requesting the addendum themselves, and explain that the signature on that addendum is only an acknowledgement that they received the document, not that they're agreeing. with the fact that the hospice has determined certain services are not covered, they feel that CMS basically stated that they feel that this would be a very rare occurrence and it should not be an issue. And if they see that it is an issue throughout the year, they would maybe consider making some changes, but in the future. But at the moment, they don't think that you're going to run into this problem. So I guess we'll see, and we'll let CMS know. All right. Question number 4, is there a time frame for when the beneficiary representative has to sign the addendum? So Medicare stated that at the time the patient provides the addendum to the patient, that's when they should sign it. So there's no specific time frame on when they should sign it, but that it should be signed upon request or receipt, rather. What are the implications on the addendum when a patient transfers to another hospice? This was also a big question. So the idea here, since the effective date of the election does not change, it's really not, what will end up happening is if the patient requests the addendum form, then the receiving hospice, the new hospice has 72 hours from that request to furnish it. Okay, so the 5 days doesn't apply because this is not a new admission. All right, so let's talk a little bit about the election statement addendum versus an ABN form. So there also has been some confusion as to the purpose of the addendum versus the ABN and when they need to be used. So an ABN is issued by a hospice to the beneficiary in situations where the Medicare payment is expected to be denied. And really it's to transfer the potential financial liability to the Medicare beneficiary in certain circumstances. Now they feel that ABN forms have limited use really in a hospice setting, but really the ABN is mostly used for services that are not going to be covered at all by a Medicare or that are not medically necessary. On the other hand, the hospice election statement addendum is intended to inform beneficiaries of items and services that the hospice beneficiary will not cover, as to the fact that the hospice has determined them to be unrelated to the terminal illness and related conditions. So that's the difference between the two documents. And what Medicare has done here is they've created a chart for us to make it a little easier for us to understand the differences in the uses of the document. So first, the ABN, that's the type of document. The purpose of the document is to transfer potential financial liability to the patient. The timing on when you are going to provide that document to the patient is before the services are rendered, because you've got to give the patient a little time to assess and determine if they are going to accept financial responsibility for those services. And when is it used by the hospice? It's used for services that usually are paid by Medicare Part A, but may not be paid in this particular case because it is not considered medically necessary. Or let's say if the patient is not terminally ill anymore, or if the patient's level of care is determined to be not necessary, not reasonable, or medically necessary. So here's some examples of when an ABN form should be used. So let's say that the patient is no longer terminally ill. They graduate from hospice, but let's say the family or the patient continues to want to have hospice care. Then in that case, an ABN form needs to be issued. Time needs to be provided, for the patient to determine whether they're going to pay for these services or not. And the patient is going to end up having to pay because it's not covered if they're no longer terminally ill. Another example could be, let's say that the patient is on continuous home care and then they stabilize and come off continuous home care, but the family continues to want that level of care, although it's not medically necessary or reasonable at that point. Then you're going to need to provide an ABN, and the family needs to pay for these services. So you need to give them a little time to decide whether they want to do that. And the same would go for a situation like respite services that we see that a lot in when it comes to respite, or maybe daily physician visits that are not medically necessary, but the family or the patient wants to have daily physician visits, then you would issue an ABN, and the patient or family needs to pay for that. All right. So let's discuss the hospice election statement addendum. So the purpose of that document, like we've been talking throughout the webinar, is to inform the beneficiary or representative upon request of any items, services, or drugs that the hospice will not be providing because the hospice has determined them to be unrelated to the terminal illness. Now, what's the timing? We talked about the timing. There's a chart for that. If the addendum is requested at the time of the hospice election, the hospice has 5 days from the effective date of the election to furnish the information in writing. Now, if the hospice or if the addendum is requested during the course of hospice care that is after the effective date of the election, then the hospice has 72 hours, which is really 3 days from the date of the request to furnish the information in writing. And we've got that nice chart that makes it a little easier. So when does the hospice use this? Upon beneficiary request, if the hospice has determined that service items, services or items and drugs are unrelated to the terminal illness and related conditions and are not covered by the hospice. So remember, we mentioned it was the beneficiary or the MAC, Medicare, or maybe a facility requesting it. That's when that would be provided. All right. And the last part that I did, the last part of the webinar, and what I did want to mention about the a certain section of the final rule is that no changes to the hospice quality reporting program was made during this final rule. So there was no change to the quality reporting. Hospices must report the HIS and CHAP for fiscal year 2021 to avoid that 2% penalty in the fiscal year 2023. So CHAP hospice surveys start July 1, 2020 with July's deaths. And then the HIS submissions start with all new admissions and discharges that occur on or after July 1, 2020. So that is the final part of the final rule that I just wanted to mention. And that is all the time that we have today. Thank you so much for joining me for the navigating of the hospice final rule. Like I said before, please put in all of your questions in the chat, and I will answer all of the questions and send out a full QA document to everyone, along with a recording of this webinar, and as well the handouts will be sent out as well. So thank you all so much for joining us, and if you've got any questions, you know where to find me. Thank you. Bye-bye, and have a great day.